doing any sort of sleep training. And like I said, I'm really encouraged not doing sleep training until a minimum of 3 months, but ideally closer to 6 months. And you also don't want to do sleep training if your little one has a cold, or if we have concerns about weight, because that's another time. If they're waking up and they're needing to eat, let's not sleep train, because that can further cause problems.
Sleep tips for kids. I know this is a very hot topic because all of us parents want more sleep. So I'm really excited for today's topic. And for those of you new members, I'm Dr. Adrienne Stewart, and I'm joined by my colleague and one of my best friends, Dr. Chelsea Gordon. And Dr. Gordon focuses in pediatrics care and for the whole family. We're going to go ahead and get started with sleep tips. And so, Dr. Gordon, go ahead.
Thanks so much. Excited to be here again. So this is a perfect topic to have put in some headphones, even if you're putting a little one to sleep or you've got things that are going on. So this is definitely a topic that I get a lot of questions about. I'm going to phase it through ages. So infancy. There are definitely things that we do for young infants versus for, older kiddos, and then definitely teens or adults. So if you have little ones, especially newborns, I'm going to go through infancy up until about the first year of life. So if you've ever heard of something called the fourth trimester, what that is the first 3 months following baby being born. I like to say it's their world. We just kind of live in it, because they're still trying to figure out what this whole outside world is all about. We're trying to navigate to what their needs are. And so really making sure we're not forcing things onto infants or newborns at that age. And instead, we're really watching what they are trying to show us as they're trying to navigate it. So there are lots of sleep programs that are out there. Everybody is going to have an opinion about everything. And even with this talk today, take what works for your family and leave what doesn't. That is going to be a huge piece out of a lot of opinions. And so one of the things in that first 3 months, I'm a big fan of not trying to push a routine, not trying to do sleep training. I really feel like sleep training needs to wait until a minimum of 3 months, but ideally probably 6 months or later. With the first 3 months, biggest thing that I want you to watch for is watch for cues. Babies at this age, especially the first 12 weeks, they are only awake for about 30 minutes at a time. So they're sleeping a majority of the day. So watching for signs of them, yawning, maybe they start rubbing their eyes, maybe they're getting a little bit fussy, and putting them down to sleep before they get into that, like they're so wired, but yet tired. Other big thing is going to be trying to be consistent. This is how we can try to create those really good routines, even at a really young age. And so trying to lay them down awake, but drowsy, to allow them to fall asleep on their own. Doesn't mean that you're going to spoil your baby if you are, holding them to sleep, or if you are rocking them. So it's not that you're going to be spoiling them. It's just that we want to try to be consistent with some of these healthy sleep routines whenever possible. After the first 6 to 8 weeks, then we see that their awake window will lengthen a little bit. So it can go maybe 60 to 90 minutes a time. And that's when we really want to make sure, again, we're monitoring those cues. And so it'll turn into more of a consistent nap schedule. One of the handouts that I created was a sleep needs handout. So not only does it go over how many naps are they typically taking at what age, how long are those naps, or what's the total sleep during the day, but also their nighttime sleep and then their awake windows. This is not going to be something that is, hard set. We're going to continue to follow. Everybody's different. So follow your baby's cues. But it can give you some framework around, is my child staying up for too long? Maybe that you're having some sleep problems because they are too tired. So ensuring those adequate naps are really important to make sure that they're not getting overtired. Those overtired infants, they can oftentimes be really frantically crying. This might be something that gets confused with colic, or we talk about the witching hour. And a lot of times it is because of them being overtired. Some things we can do if that happens. So if your kiddo is having those times where they just seem like they're frantic, then trying to go into a quiet room, maybe dimming down the lights, making sure we're turning off our screens. There's not too much, background noise, with the exception of sound machines. Some of those sound machines can be really beneficial for infants because it helps to mimic those calming sounds, remembering that they were in the amniotic fluid and that was kind of muffled. And so we can see that they like either the heart sounds or the whooshing water sounds. So that can be really helpful for some kids, but in others, especially if they seem to be really sensitive from an early age, not having any of those excessive sounds. You're going to see a lot of marketing in regards to baby products, especially in the first year of life. And so things like swaddles or sleep sacks. And a couple of my favorites, there is the Magic Merlin. That one can be really beneficial. I also really like some of the ones that are weighted. Biggest thing with sleep at this age is making sure we're placing them on their back to sleep. And so some of the thicker swaddles or blankets can be helpful because it makes them feel like they're being held. What the American Academy of Pediatrics wants me to tell you is it's okay to feed your baby in bed, but it's not okay to sleep with your baby in bed. And so talking about co-sleeping. Co-sleeping for me as a parent, I have 3 kiddos myself, and at various points in each of their lives, yes, we co-slept. I think co-sleeping can be done safely, but there are times where we say we definitely do not want to co-sleep. So if somebody smokes, definitely not a time to co-sleep. If somebody is under the influence of drugs or alcohol or is so sleep deprived to where they're not going to know if they're going to roll over onto baby, or if somebody as a parent is not comfortable with co-sleeping, you're not going to get adequate sleep too. Benefit of co-sleeping is to try to create a environment where both baby and parents are sleeping well. And so if you have questions about safe co-sleeping, definitely either reach out to Dr. Stewart or I, or ask your own healthcare provider, because there's lots of controversial thoughts around co-sleeping.
What are your thoughts about because for a while, my first daughter did not sleep very well. And so I did a lot of these things. And so what I found too, now having 2 kids, is that every kid is different for sure. And some kids need more of these things and some kids don't. Yes. And, but a couple things that I had was where it was like the little co-sleeper right next to the bed. Yes. So then I could breastfeed and then go, have a little bit of space there too. Yes. So that was nice too. And then, it wasn't Magic Marlin, but there was one that then to take naps on. Yeah. What's your thoughts on that one? Because I really liked it, especially with my second child.
Yes. So with any of them, I like to highlight, again, what American Academy of Pediatrics wants me to say, that there are no approved sleep devices. And so any of those things are best used for supervised sleep. So I like that you highlighted naps. Yeah, we need to have a place that we can safely put our babies down to sleep. The concern with some of the DocTalks, and I used one as well, especially with my third, and it was life-saving for me. And I used a co-sleeper, one of the sidecar co-sleepers with my first, and for me, it didn't work. I liked the idea of it, but I found that it was one more place that I was just putting my receiving blankets and not actually putting her back into sleep. But DocTalks, the biggest concern is that when babies are sleeping and say, especially in the first couple of months, they turn their head and they can get their face kind of stuck in that soft pillow siding. And so that's where we have to say, look at the benefits versus the risk. Yes, it was something that I was comfortable using, especially for visualized sleep, but not something I would necessarily say use for extended period of times, or if you're then sleeping as well.
Mm-hmm. Yeah. I appreciate that. I know this time of parenthood, which is so sleep deprived. And then it's like, you're just getting to know your child, and that child could be totally different than other kids that you may have had. So This is tricky, but it is, there are, a lot of different, tools out there. So I appreciate you sharing that.
And there's even big, rather than co-sleepers, there's like the snoo bassinet. Have you heard of that one?
Oh.
Okay. So the snoo, this is one that I wish I had with my first because she was a terrible, terrible sleeper. And I'll talk a little bit more about some of the things that I think that contributed towards that. But it is a bassinet that rocks slowly side to side, but you swaddle them into it. So they can't roll over. So they only are on their back. So it can be really beneficial for the Back to Sleep campaign, decreasing risk of SIDS. And then they get zipped up into it. So they are nice and cozy. And so, but then they get that slow rocking movement if you want it to be on there. Unfortunately, it's really expensive. So it's a really big barrier for some parents who would like to have something like that, but it's an option. I don't know if it's on the approved sleep devices. I should probably know that, but I don't know off the top of my head.
One thing is that what I want to, sorry to interrupt you, but I just want to say is that I always look to see if there's a recall. Yes. Because I had some devices too that, I remember we had Rocket Tot. I forget what it was called.
Yes. But the rock and play.
Yeah. And then intuitively we're like, I don't know if this is good. And then like years later found out that it was, recalled. And so it's like, not only did we not donate it, we just trashed it because, and that's the thing too, is that, so if you get hand-me-downs from friends or family members, make sure it's not on the recall list.
Correct. Yeah, that's an important piece. So for that one, there was two things, and this is what I'd encourage you to look at with any sleep device or things that the kiddos are sitting in or laying in. That one had a bar right behind the back of their head. So it was not only increasing concerns with the flattening or what we call plagiocephaly, but then also we were seeing a lot of mold that would accumulate in there because babies would spit up and then it would stay in that area. So there's all sorts of different things. But yes, that one did eventually get recalled.
Wow.
Yes.
So many things to think about and consider.
Which can get overwhelming. There are also a lot of sleep books that are out there. And I didn't highlight too many. I'm going to go over one that I really appreciate, and I'm going to talk about why. So it's called the No Cry Sleep Solution. So I have a lot of families who are really, really hesitant about doing any sort of sleep training. And like I said, I'm really encouraged not doing sleep training until a minimum of 3 months, but ideally closer to 6 months. And you also don't want to do sleep training if your little one has a cold, or if we have concerns about weight, because that's another time. If they're waking up and they're needing to eat, let's not sleep train because that can further cause problems. So really talking to your healthcare provider about whether or not your child is at a place where it's appropriate to do sleep training. But the reason I liked the No Cry Sleep Solution is because it was not just the cry it out method, not saying that cry it out is not something that can be appropriate, but for families who either choose not to do it or want some other tactics to be able to implement, what I appreciate is that there's so many things that we can do other than just laying babies down and allowing them to self-soothe. One of the things is trying to separate the idea between either sucking or feeding associated with sleep. And so this is something we can implement earlier in life. And there's something called eat, play, sleep, to where we feed babies, we let them play for a little bit, engage in some sort of stimulus, even in infancy, whether it's tummy time or talking to them, and then put them to sleep. And the reason for that is because when we take away that association, either with the pacifier, and again, pacifiers are not bad, all 3 of my kids used them, but it takes away that connection between thinking that they can only fall asleep if they're feeding. So
I really appreciate that one, because I definitely got into the rut of like breastfeeding till they're like in a milk coma to then fall asleep. So that's good.
Yeah. And the tricky part, and I did that as well, because, we just do what we have to do sometimes. And the tricky part is then you're stuck holding that baby, which isn't always a bad thing, especially in that newborn phase. That's what you should be doing. You should be holding your babies. But when you are a busy parent, or if you have other kids that you're having to take care of, it's really hard to be nap stuck. And so when we feed them until they're fully asleep. And then if we're attempting to lay them down somewhere else, we're interrupting that sleep cycle. Some babies will sleep right through it and you can transition them. And others, the moment you do anything, that you rouse them and then you have to start all over. And so if you have a baby that is doing that, then trying to separate those things out, or soothing with, not picking them up and just either gently rubbing their tummies or their back, depending on how old they are. Some of those types of things that we can do with that self-soothing. There are lots of sleep programs that are out there. And so I'm not going to highlight on those just because I don't have a one specific one that I say, yes, I have either done myself personally or have looked into the material to be able to say, yes, this is one that I can vouch for. But there are lots of sleep training programs that are out there. What I would encourage is that it's with a sleep consultant, somebody who's actually done some education and some training, just like we would with either lactation consultants or healthcare providers. So that's really what I want you to look for if you get to that place where you are considering a sleep coach. And then, like I mentioned, there are some times where we can see something that contributes to poor sleep. So if you have tried all of the different things, and this is again through the first year of life, things I want you to be thinking of what could be contributing towards my child not sleeping, and I've tried all of these other things. Anemia. Sometimes we will check. So a lot of the pulmonologists or the ENTs, if we have a kiddo that we've referred over there, they want to make sure that we've done a CBC and a ferritin to rule out anemia. That's a really important one. Also, if we have food allergies. So I mentioned with my oldest, she was a terrible, terrible sleeper. And what we discovered is not only did she have true food allergies, and that was waking her up because it was causing more GI upset, but then also things like silent reflux or actual reflux, that those can be really big contributors towards sleep problems. So something that I encourage you to reach out to your healthcare provider regarding of if you're feeling like there's got to be a reason for why my baby isn't sleeping. There's not a lot of supplements that I would recommend at this age. Sometimes I will do Calmerite glycerite, which is an herb or a combination of herbs that we actually talked about in our pediatric anxiety webinar. Lemon balm, chamomile. So I will do things like chamomile tea or camellia homeopathic, especially if there's things like teething that is contributing towards the poor sleep. So there's a few of those types of treatments or supplements. But within the first year of life, there's not a lot that I'm going to say, yes, definitely try this. Do you have any that you have tried with your own kids or have had parents had success with?
No, I think that, you really kind of nailed it there with a lot of it is more of, I feel like training as a parent things more so than like, oh, they need something external. It's more or less like, okay, the consistency, the patterns, the way we are as parents too, because I know there was points where I would just get agitated, and anxious and like, I'm so tired. And so then I think that there was times too that I'm so blessed. My husband was continues to this day, so supportive with the kids too. So I needed to recognize when there were times that I just needed to throw in the towel and then change off. and so to me, that was gold. Is recognizing when I'm kind of struggling. So that way, especially as mom, like I feel like babies, breastfeed are so close and then they pick up, on if mom's energy is agitated and, it's no wonder if baby, is having a hard time there too. And the thing is a lot of times I'd be to that point and then I'd hand off baby and then he would take them and it'd be like 30 seconds later, they'd be asleep. And I was like, almost infuriated.
Yes.
Like, I've been doing all this. And then I'm like, it's like the pickle jar, it's like, I loosened it for you,
That's right.
Pop. So, but I do encourage, that as well of like recognizing your own internal energy and vibe you're bringing to your infant. And then sometimes you just got to like, if it's not working, like just, if you can, hand off, baby. Like there's almost like just like an energetic, like, okay, we could try something, like start fresh.
Yeah.
And that really worked a lot of times for us too, is like, okay, I got to throw in the towel.
Yeah. And that's huge. Recognizing it, like you said, but then also if you don't have a partner to be able to hand off, know that it's okay to put baby down in a safe place and walk away. Because sometimes, like you said, they are feeding off of our energy. Maybe they are overstimulating and we're trying all of these different things. And sometimes we do just have to put them down in a safe place and be like, okay, I'm walking away, or I'm going to grab some tea or some coffee, or I'm going to walk outside. Maybe I scream, maybe I yell, maybe I just take a deep breath, but knowing that that's okay to do. There's a lot of other things. And I tend to find that within the first year of life, parents in my practice, they kind of just do what they have to do in order to survive. And then after age 1, they feel more confident in saying, all right, something has to change. I've dealt with this for the first year. I have tried these various things. My baby and now toddler is growing well. They're developing well. Their weight is good. And now they just get to their wit's end and say something has got to give. So this is oftentimes an age where we're doing a lot more interventions, if you will, or saying, yes, there are lots of things that we can try. And there's lots of things that will contribute towards that age too. So one of them has to do with not necessarily the 1-year-olds, but more so potty training age. We're starting to see what are the things that are contributing towards them not wanting to sleep. So again, anticipating their needs. So just like we talked about in infancy, what are the things that they need? Are they needing somebody to stay with them in order to fall asleep? Are they going from maybe they're having a leap or developmental change to where all of a sudden they're learning to stand up in their crib? What are the ways that we can help to say, all right, what's the solution to that? Having a mantra of something that you say, it's not nighttime, see you in the morning, and having something really consistent sometimes can be really beneficial because we're not engaging. This is also another time to where kind of check our emotions at the door. We do have to be as consistent as possible. Oftentimes parents in my practice will hear me say, it is toddlers' jobs to figure out what those boundaries are and push those boundaries. And then it's our job as parents to make sure that we're reinforcing those boundaries. They're trying to just navigate it. And so we need to be able to say, all right, yes, this is okay, or no, this is not okay. Here are the appropriate times. And so that this is a huge age, especially in regards to sleep. 4, I'm going to separate it out really quick between kind of 12 months and say 2 to 2.5, because there are certain things in that earlier age range that might not necessarily apply to the older range. So the first year to 2.5 years, we will see things like maybe weaning, or maybe not nighttime waking, because whether it's breastfeeding or bottle feeding. But again, that's where we say, send in reinforcement. I will oftentimes tell a breastfeeding mom or chest feeding mom who wants to stop doing that, take a holiday. Maybe they take a little mommy vacation, out of sight, out of mind, having somebody else go in to do some of the sleep, not even sleep training at that point, but the nighttime wake ups. And then that parent also gets a break. But sometimes we have that pent up energy of like, we have to go in and try to solve things. So if we're completely out of the picture, maybe you go for a walk or you run some errands at bedtime, but that can be really beneficial. Having a nighttime routine. So that way, again, kiddos anticipate what is going to be happening. So trying to be consistent in terms of, all right, we do bath time, we read, we say prayers, whatever is a part of your nighttime routine, and then putting them down to sleep. Sometimes at that age, regardless of potty training, we'll see things like really heavy wetters. And so then they're waking themselves up because they are wetting the bed. So doing things like overnight diapers. They even have these extra inserts that you can put into diapers to help with absorbing if those nighttime diapers aren't enough. Doing wool jammies or things that are going to absorb that moisture more, but then wick it away from the skin. So there's a few of those types of tricks. But biggest thing at that age is in regards to trying to be as consistent as possible, because they're at an age where they know kind of what is happening, and trying to be as consistent. Crawling out of the crib is also something that I experienced with one of my kiddos at, unfortunately, a very young age. And so that is oftentimes a big question that I get asked in regards to sleep of, well, when do we transition out of sleep? When do we transition to a either mattress on the floor or a toddler bed or those types of things? So times in which we say, yes, you need to do that transition when they're crawling out, then it's no longer a safe place for them to be able to sleep. They do have a couple of devices to help if you feel like your child is not ready for that. They have some of like the sleep tents. It kind of turns it into like a little playhouse type thing, but then they can't climb out of their crib. Or you can lower it down, sometimes doing like a makeshift platform, which is what we had to do to lower that crib, a mattress as low as possible, even below what the crib was intended to do, but still done safely. But one time I'm going to tell you that you absolutely need to take your child out of a crib is if they're potty trained. If they're potty trained, they need to be able to have access to be out of that crib or have access to be able to go to the bathroom, because otherwise it's just no longer a safe place for them to be in. Do you find that your kiddos either at their age currently or before have things or tactics that they are doing to prolong bedtime, or things that they're saying, Mom, I need this?
Oh yeah. Definitely. There's usually the water. Oh, I need water. And in some sense, it's actually kind of contributed to our routines, which is kind of nice. So it's almost like, okay, we're in bed. Oh, Mom, I need water. And so then I leave the room and go get water. And a part of me is like, this is just kind of a nice, just like, just reset. So water. But then sometimes, it gets to be a lot. And I'm like, oh my goodness, I'm getting water. I'm now telling the story. Oh, I got fluffy. The list goes on. And then all of a sudden you're like, no, hold up. They're smart. They're testing their boundaries, but
Yes.
It changes too. I think that's one thing that I'm kind of, as we're going through all the different ages too, I'm like, wow, I did used to do this. And then now, they don't need that anymore. And so I've witnessed that as well, as that with time, it changes.
Yes. And so exactly what you were saying, either building it into your routine or anticipating their needs. So the same type of thing, it's like, yes, it changes, but we might do some of the same tactics that we did in infancy. So just like we're saying, okay, anticipate their cues or anticipate their needs by watching their cues, we're going to do the same thing at this age, regardless if it's age 1 or all the way up to 5 or 6 or older. All right, what do we know that they're going to ask us for? So building some of those things into your routine. Oh, let's go ahead and get your water. Let's bring your water, put it on your nightstand. All right, let's grab all your stuffies. Okay, what book do you want to read? One more kiss. Do you need any more things? And so trying to anticipate those things. I oftentimes would say, all right, you get three, what do we call them at that point? Not 3 wake ups. You get like 3 things before I say, oh, nope. We grab all the things.
I like that.
And so that way we're allowing them to not be like, okay, bedtime, I can't do anything. That there are going to be times where, just like us as adults, maybe they're thinking about something. Oh, Mom, I had this one thing. All right, you get 3. And then it's not nighttime. So trying to build those things into their routine. Also,
go ahead. Just because I know that I get this question too. And so I'm backing up a little bit. Well, maybe, I don't know. It just kind of depends. I think it's, the question really is, at what point do they not need to feed or have a bottle in the night? Because so many times if they're waking up, it's like, oh, they're hungry, but it's like, actually, no, and when should we be like, okay, not always just feeding when they wake up?
Yeah. So that's a really great question. And I wish I had like a one size fits all approach to answer, but there's not. We can see babies that are sleeping through the night from the very beginning, and they make sure that they get enough of their calories during the day. And then we might see babies that have some feeding difficulties that they really do need that extra time or those calories. So I think it's going to be something that working with the pediatric provider to be able to say, is my baby at an appropriate weight to be able to do that? If weight is not a concern, then typically sometime around 9 to 12 months is something that can be an age range, definitely over age 1, but there might be certain underlying conditions medical wise that we would say, nope, you just have to let them either eat or drink something. So
what are your thoughts about food, like the meal before bed too?
Yeah, good question. So I think that there are some times where having either a fat or an extra protein at night before bed can be really beneficial. So if you notice that you have a kiddo that has a really rapid metabolism, they tend to be on the slimmer side, they are eating frequently throughout the day, then yes, that might be a time where we say, let's definitely give them an extra snack. That helps. We go back to what we talked about with adults with cortisol and melatonin response. And so sometimes we actually might need to do more of a carbohydrate snack. So it kind of depends there. One thing we do, especially in the older kiddos, making sure that we're limiting too many fluids outside of breast milk or formula. So older kiddos, if they are taking their water to bed, especially if it is causing nighttime wetting or the heavy wetting and they're waking themselves up, then trying to limit some fluids before bed.
Do you have any foods? So I was just, it's so funny. I think I have a good one that I'm just staring at right now. I actually have some chia pudding here.
Yeah.
But I think that something like that has some fiber, and some kind of healthy fats might be something too. Because it's so funny. I mean, remember, it was like, oh, give them rice or something like that, which is
fill their bellies.
Yeah, fill their bellies, but that's kind of breaks down to sugar. So I feel like if the more fiber and, like you said, protein and fats, that's going to help stabilize their blood sugar while they're sleeping too.
Yeah.
But anyway, I just chia pudding might be a good thing.
Yeah. You'll hear things like, butter and things of that nature. And the reason behind it is it's because it's calorically dense. And the fat helps, like you said, Dr. Stewart, it helps to really maintain blood sugar levels. So yes, I think that that's something that's appropriate. But there are other kids to where they can't eat too close to bedtime because then they get upset tummies. So I think it really, again, it depends. But those are definitely things that we can try.
Yeah.
As we gear more towards in the older kiddos, then we start to see that they, again, needing that consistency, the routine, kind of thriving on that, there can be certain things that we can try to help to give them a little bit of autonomy. So there's devices. One of my favorites is like a ready to wake clock, because then even if they can't read time, they can change colors, because then they know, okay, I need to be in my bed. And it's something that's not us as parents or care providers who are saying, okay, you need to stay in bed, or it's not time to wake up yet. It gives them that a little bit of autonomy to be able to say, okay, now the clock is green, I can get out of bed. And you as the parent or care provider can set it to certain times, but it can give them that visual. The other thing that I liked to do is get a really expensive clock, inexpensive clock, one that you can take the cover off. And what we did is we actually drew like color wheel type things on the different times to be able to say, okay, from this time to this time was nap time. So that way they could see the big hand in that kind of section. And we knew, all right, this is when we're supposed to be in bed for nap time, or this is when, and we did this for one of my kiddos who really struggled with bedtime, but we had our bedtime hour over here, and then there was a red. So if we got into the red, if we were not listening, and obviously it's not going to be the case for every single night, but they knew if it got into the red, that's when we say that there could be some sort of either a consequence or something like that. But again, having those visuals to be able to give kids autonomy to be able to say, okay, this is when I'm supposed to be doing what can be really beneficial.
And speaking of visuals, is how the importance of darkness too. Making sure that not having any TV or any kind of extra stimulus to keep them awake is really important.
Yes.
So thankfully, my youngest daughter is really good with darkness, and I think it's for long-term health and helping with melatonin production, that is really good. What I've gotten a little bit of a rut with is my oldest daughter. She likes light at night. And I, like, as a doctor, I'm like, there's so many reasons to not have a nightlight and to have all this, but it soothes her. So, for me, I said, okay, I'm just going to let her have some sort of a night, even over the holidays, we had a little Christmas tree, it was soothing to her. And so, but then I'll like sneak in there after she's asleep and I'll turn it all off. So anyway, any other thoughts there about,
yes,
lights and darkness?
Yes. So blackout shades. I do find that if you have one of the cooling colored lights, they are less harsh, but it still gives them that feeling of, okay, it's not too dark in here, because there are a lot of kids, they don't like their door closed, they don't like the all of the lights off, or having one of the lights elsewhere in the house that is on to at least just give kind of that ambience. Salt lamps, those give off a really nice soothing light, but aren't too bright, but some of those types of things.
And that is more of an amber hue too, which is better than the blue. Yeah.
Yes.
No, I like that salt light. That's a good one.
Yeah. The other thing, as we're talking about, stimulation, sometimes it's not always just the light or devices, which those things can be really important. There are some kids that have to get their wiggles out before bed. And so if you have one of those kiddos that it might sound counterintuitive of saying, all right, let's do some laps around the house. But there are some kids, they really need to get out any of that physical, just that pent up energy. And so if you have one of those kids, have them do like little family laps, obviously not right before bedtime. Maybe you do it before you start the wind down routine of brushing your teeth or reading a book, but maybe doing something to get that extra pent up energy. Whereas there's other kids to where they may be stimulated by that. So really, and knowing your child and seeing, okay, what's their personality like? Do they thrive on that calm routine, or do they need to get some of those wiggles out? Other one, not necessarily related to sleep, but sometimes kiddos still associated with sleep, not related to lights being out or darkness, but sometimes when kiddos are not only afraid of the dark, or maybe they're worried about nightmares or monsters, there are some things we can do with that side of things. So one of my favorites is to do a spray, and I meant to grab it. I have an example here in my office, but it is just like a little amber spray bottle to where you can put in some essential oils, include them in that process, whether it's lavender or lemon or citrus or something of that nature. And maybe you do either a sleepy spray, or they can spray it on their pillow, or it can be used as like a nightmare be gone spray all right, let's spray those monsters away. And that also can be used if they wake up in the middle of the night. So I've got lots of kids in the practice who they get a really bad anxiety before sleep, or they'll wake up in the middle of the night every time they hear something. So having something they can physically do can be really helpful, especially, again, taking it out of us as parents of being that problem solver. Oh, okay, here, you've got this. You can spray them away. That can be really beneficial for some kids.
I love that. That's so cute. And that's fun. And lavender, just introducing them to essential oils and giving them tools that they can do on their own. That's going to be tonight's plan.
Yeah. And it's a really fun activity, and they get to smell it. You're engaging your senses, which Dr. Hung talked about, like mindfulness. So that could be an activity of saying, okay, let's smell it. What does this smell like? Do you feel like this is calming, or do you feel like, oh, this energizes you? So especially for sleep, choose those calming scents, so that way you're not doing something energizing. So yeah, super fun activity. I love doing that. I actually saw one at a local store, and it was marketed as a like a nightmare be gone spray. I was like, dang it, I should have thought about that.
I love it.
But super fun and easy to do at home. There, again, just like we talked about with the infancy stage, there are some things where we'll say, all right, let's make sure that we're ruling this out as something that could be contributing towards the why behind why kids are having sleep disturbances. So again, anemia, I always recommend doing some screening labs at 12 months. And that does help with decreasing or identifying anemia before it tends to show symptoms. Glucose, we talked about that, blood sugar imbalance, really making sure we're monitoring for concerns of things like diabetes. Thyroid, it may sound really young to look for thyroid disorders, but especially hyperthyroid, to where they are just extra energized, and that can really affect sleep, and vice versa, to where if kids are just seeming like they're really tired all the time and they're sleeping too much during the day, and then it affects sleep later at night. So really looking at some of those things. Sleep apnea. Kids can have sleep apnea as well. So making sure that during their well child exams, the provider is looking at the size of we call it tonsillar hypertrophy, how big they are, because that can be an obstruction. It's not always if they're big that it's causing an obstruction. So if you're noticing that your kiddo is waking up really frequently, what I'd want you to look for is, are they pausing? Is their sleep interrupted or paused? Are they waking up gasping, or are they waking up seeming like they're pause, and then take a big deep breath, almost like what they did when they were newborns, which periodic breathing in newborns, completely normal. But at this age, 1 to 5 or older, not something we want to be seeing. So those would be times where we definitely want to make sure we're looking into that.
And I'm also a big fan of pediatric chiropractic care too. I think that obviously coming through the birth canal can be, a bit traumatic. And so, but yeah, I think, jaw align, like there's so much alignment just that could impact their sleep as well. So the physical structure.
Absolutely. Tongue ties. So if there is a toddlers or infants, less so in infants, but more so in toddlers, to where if that frenulum, so underneath the tongue, if that is restricted, it's really tight, then it doesn't allow the tongue to rest on the roof of the mouth where we want it to. And so we can see that it slides backwards, and that can cause some pretty big sleep disturbances in not only kids, but then us as adults as well. So talking to your dentist or talking to your healthcare provider, seeing if that is something that is contributing. And then this is an age where I feel very comfortable using certain supplements. So there are times, so again, ages 1 to 5 or older, up until about teens, because then we get into a different set of herbs or nutrients or things that we can try in that age range. But this is a time where magnesium can work really well. If we think about Epsom salt baths, it helps to relax the muscles. It helps to calm down the mind. So especially if you have a kiddo who is more of a worrywart or anxious, doing magnesium to help with calming down the mind and the body. You do have to be careful. Magnesium, because it's a relaxant, can cause loose stools. So if you're finding that your child is then having loose stools or diarrhea, then you want to make sure that you're backing down on the dose. We can do herbal blends. So Calmrite glycerite, again, that's one of my favorites. We can do just Melissa or lemon balm. I don't tend to use the GABA and L-theanine in this age range. I will use glycine. Glycine works really well, pairs well with magnesium too. But if there's one that you're like, I really want to try something, I would start with magnesium. That's usually my go-to. So a brand that you can find really easily over the counter or can be in the full script catalog is by Natural Vitality. It's called Calm. And so it is a magnesium citrate, or they make gummies too. From a dental health perspective, dentists will hate to hear me say recommending gummies, but sometimes if they don't like the bubbly, effervescent aspect of the Calm, then doing the Calm gummies can be really beneficial. And then sometimes I will use melatonin. Not all the time, but I use it as a cycle to be able to say, okay, let's maybe get back into a sleep routine, or maybe sometimes around big holidays or changes or moving or daylight savings or any of those types of things where we're like, we just need to get back into a routine, that can be really beneficial. It can trigger nightmares. So you do have to be careful if you have a kiddo who already has a tendency towards nightmares, but use the lowest dose possible. So for 1 to 5, I usually start at 1/4 to 1/2 milligram. One of the products that I like, it's not available on Full Script, but it's called Tired Teddies. What I love about that product, it only has 0.3 milligrams of melatonin, and then it has calming herbs. It has chamomile, it has passion flower. So it's not just, making them fall asleep. It helps to act synergistically with some of those other herbs to be able to have that calming effect.
One that I commonly use is liposomal melatonin, and it's a spray. I think Redizor, but you can find that on Full Script. And that's nice too, because it's lower dosage. So you can do just like one spray and then see how your kids responds. Because I notice my oldest daughter responds really quick, almost like too quickly to melatonin, where my youngest one doesn't so much. So, but I do think that it's not something to be overly scared of using. I think melatonin is good. It's just all of a sudden, if there becomes a dependency on it, not that, or any of these things, with anything, you don't want it to be like, oh, I have to give them something to sleep. Mm-hmm. So,
then they build it into their routine. They think that they can't go to sleep unless they have that other product.
Yeah. But I'll just share. So, our family recently had COVID, and, being sick as a parent, which I'm sure some of you have experienced this, is really tough when you have to take care of your littles. And so there was times that I was like, I need to get to sleep and I don't have the time to do the full, thing. And so I gave my kids melatonin at that time because I was like, I got to feel better so I got to get to sleep to take care of them. So I personally went to the liposomal melatonin spray.
Yeah. And not to change topics too much, but melatonin can be really beneficial as a part of the treatment plan for COVID. And so, especially because sleep is so beneficial. And so, that's an appropriate time to be able to use it. There's lots of good options.
How about medications? So that's what I want to, talk about too, because at this age, I'm not a fan.
Yeah. So there are times and places for it. So I do have some kids in my practice who either have really, really significant anxiety or ADD, ADHD, and they can't sleep. So they have this significant sleep latency. And what we know about sleep is that it is really important, not only for our immune support, our mood. And so it's an important piece of it. So there is a time and a place for it. I usually don't prescribe it. We can do things, some prescriptive medications, but I'm usually working with a psychiatrist at that point to be able to say, okay, what else can we do? We've already ruled out sleep apnea. We've tried some of these other things, but yes, there are medications, but not ones that I would be
first line. Yeah.
Yep.
How about, and I don't think Benadryl, it's especially because I've unfortunately, heard situations where they, kind of skip through all the other things and went straight to Benadryl, but that crosses the blood-brain barrier. And these little kiddos, were neurologically still developing.
Mm-hmm. Yeah. So I'm not a fan of using that either. We have plenty of other options. If it were something that was, necessary for whatever
allergic.
Yeah.
Sure.
Yes. Yeah.
Okay.
And then teens. So I have a teenager in my house. So thankfully she's my firstborn who was a terrible, terrible sleeper. And now, she's a great sleeper. But some of the things that we have really tried to do to create those healthy habits is make sure that we have some healthy boundaries on things like cell phones, electronics. And so I'm a big fan keeping their phone out of their room. That is something we don't need to have access to it. We don't need to be able to be laying in bed, checking social media or texting our friends or those types of things. We need to make sure that we're saying, okay, nope, I'm going to go charge my phone. It's going to be either out of reach or ideally even out of the bedroom altogether, depending on the age. Also setting just electronic limits. There are some great apps that are out there, and we're going to talk more in detail about that at an upcoming webinar or workshop. But there are some great apps that you can set parameters on how much screen time they get, or maybe you turn your router off, or just trying to make sure that we're creating those healthy boundaries around that. Because what I'm finding is that teens are staying up way too late. And then unfortunately, high school starts way too early. And so they're just not getting the sleep. And that is going to perpetuate things like anxiety or frequent colds. And so I think one of the big things that we really have to teach our teens is how important sleep is. Mm-hmm. And so I think that is a huge one.
The arguments within the family too. I know. I mean, just with my 7-year-old, sometimes just getting up and going to school, it's like, wake up, and I'm like, and I always try to tell my daughter, I'm like, hey, we're on the same team here, and just reminding as we're kind of unfortunately having to like really push her to get up is like, we're in this together. Yeah. Because I can see how it could very easily turn into a fight.
Mm-hmm, absolutely. And then again, helping to create that autonomy to where we're not being that bad guy with our kids of the waking up. So less of the falling asleep, but then also the waking up side of things. So one thing that we can do to help to kind of, again, I'm a big fan of trying to create that autonomy, allowing them the opportunity to choose, but also putting some power in their hands, so to speak, or some resources to feel like, again, we're not always talking at them or fixing things for them or whatever. So one of the things, and we're actually going to be trying this in our house, but I've recommended to some patients, is maybe having one of the happy lights or things that we'll use for like seasonal affective disorder. Here in Washington, we get a ton of sun, or excuse me, we don't get a ton of sun. We get a lot of rain and dark clouds, and especially recently with our snow and now forever rain. But having a light can be really beneficial. And a lot of them, and so this goes against what Dr. Stewart was saying of at night, we don't necessarily want to have that light. But if we think about our body's normal response, being able to wake up with the sun and that gradual light, that helps to turn on those hormones in our body who are like, oh, okay, now it's time to get up. And so if we do that same thing with a gradual light turning on, so maybe you have one sitting next to the bed that is set at a certain time to start turning on gradually, that can be beneficial. What I think is really key for teens is not having them wake up abruptly and hit the door running. That is a recipe for disaster for some other things that we might experience, again, anxiety, stomach aches, waking up nauseous. So if they're waking up to an alarm, making sure that it is not one that it's this harsh sound, that it's like, you're waking up with that instant cortisol surge. And so having something that's either a gradual increase in sound or something that is a little bit calmer, I think is really important. But again, that's all kind of like the waking up and then things to help with kind of setting parameters on it. But this is an age where I will more routinely use things like melatonin to be able to, again, I don't tend to be a fan of having it be something that is taken nightly, but instead something that is used to kind of reset into a cycle. And I think that can be beneficial. But I will do GABA. So GABA is a neurotransmitter that's very calming. It is great, especially for those kiddos who are having a difficulty with sleep due to anxiety or racing mind, or I'll do L-theanine. And these are things that don't necessarily have to be done right before bed. Instead, they can be done earlier or at different times throughout the day. And then we might consider doing some herbs to help with resetting that cortisol balance. And so Cortisol Manager is a product that I use a lot in my practice. And I feel very comfortable using with teens, especially right now with kids being overwhelmed with not only everything happening pandemic wise, or depending on their school schedules or sports, kids are stressed. And the amount of anxiety that we're seeing in clinical practice is alarming. And so that is something that can be beneficial.
Absolutely. One thing that I want to share too is, especially because there's different tools and different devices and so forth. And again, just how priceless sleep can be sometimes. So for some kiddos, they may be more sensitive to EMFs. And especially because we have, all the devices and so all electronics and so forth. So I think trying to turn that off in the bedroom is important. They have different, like where you can turn your router off at certain times as well. But then the other thing too, to consider, if you're like, oh, my child, I can tell is like, gets very overly stimulated, is check their mattress. And they make different mattresses that don't have the metal coils in them. So two brands, one is it's called Hope mattress, and it's coil free. And then the other one is by Lifetime. But that is something that I think is worth looking into as well. I know for my youngest, we recently bought the Hope mattress, and I don't know, I feel really good about it. I think it's like, you know what? She's around so many electronics all the time and just less metals. And depending on, if you live in an apartment and all the different potential EMF sources. Mm-hmm. So just consider that too. So yeah, consider the mattress, and just too, if it's a really old mattress or whatnot, same thing for adults too. Mm-hmm. I think that kind of goes back into that kind of structural component as well. So consider that. I just want to, if you're okay, I just want to mention some other things too, just for almost adults, for us to think about device-wise. Yes. Now there's more and more things out there. There's tons of different apps, but really trying to identify too of like, as adults, why might we be waking up or not able to fall asleep or stay asleep? Mm-hmm. So for women also, consider progesterone. If you're having, and definitely during our 40s, it's very common for progesterone levels to go down. So that might be something that could help our sleep by supporting that progesterone. Again, this could be a whole nother talk about sleep for adults, but I just want to highlight some of these things just to make sure to keep in the mix and to talk to your naturopathic doctor or schedule with one of us docs, and we can dive in a little bit deeper there too. Consider sleep apnea too. Unfortunately, I'm seeing it a lot. And there are more at-home tests. There's one that I use called WatchPat 1, and you can do it at home, and it's very accurate. So keep that in mind. Now they have the Aura Ring, and that just, gives us more information. We're finding more and more wearables that gives us more information about ourselves. As far as also other devices to keep in mind, there's one called an Alpha Stim that you can wear, and that really I've found to be beneficial for anxiety, pain, definitely insomnia or PTSD. But that upregulates alpha waves in the brain, and it kind of brings you into like a light meditative state, which I feel like so many of us could probably use more of.
Is there an age range that you would not use that in?
That is something that I would say ask maybe or look at the Alpha Stim. Yeah. I'll be honest, I've put it on my kids and they've responded really well to it. So I think, I think that it can be appropriate for sure. Yeah. And the other thing that I use, and for any of the women or men that get really hot at night, it's called an Uller. And so it's something that we put on top of our mattress, and you can change the temperature while you sleep. And so like my husband can sleep in like ice, and the kind of generally the more cooler, you get into a deeper sleep, which is great. But I don't have that skill set, but it's really, really cool because I can change it to where it's nice and warm when I go to bed. And then after I fall asleep, it will cool down, and then it will warm up before bed. So that's kind of my alarm clock. Yeah. And I love it because it's not a beep, 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 and, but yet I can still once I'm asleep, go into the cooler state and I sleep better, and it helps with my pain levels too. So that has been a really nice tool that I've implemented too.
Yeah, I'm going to have to look into that.
Yeah, no, it's really, it's lovely. And then it's lovely too, that I've noticed in the winter time too, is that like I'll turn on the heat before I go to bed, and so I'm nice and cozy, and then I can fall asleep, but then yet still get into that deeper, a little bit cooler sleep. So and then I love not having an alarm clock.
Yes, absolutely.
Yeah.
Sorry, you're seeing, I was talking about how dark it is here in Washington, and now the sun is coming through, and now so I apologize if you are having a hard time seeing me. I'm not going to complain, because this is something we desperately, desperately need right now. But in case you're like, where'd Dr. Gordon go? There's a bright light back there. That's why.
Yep. Love it. Anything else, Dr. Gordon, that you want to make sure to mention, or any take home points?
Yeah, I think I just want to go back to the beginning, in the sense of, we kind of went over kind of the spectrum of ages. I think definitely look at the handouts if you have questions about either the wake periods or the nap schedules, but it's not set in stone. So don't be alarmed if you're like, my child is sleeping either way more than this, or not getting enough sleep, and they're hitting all of their developmental milestones, and your pediatrician has not, or healthcare provider has not had concerns. Their recommendations, their averages. And so again, with anything, take what works for your family, leave what doesn't, and empower you to make the best decision you can. And these are some things that we can hopefully help you with, trying to get more sleep in your household.
Thank you so much. All right, guys, we'll see you next time.